brought to the hospitals, and the events were not documented. So, if you remember early this morning, Dr. Zaki shared about the case of the boy who died in Pulau Sapi in 2006. So this is most probably the earliest reported cases, but this one is also by the newspaper. But this case, my colleague did the postmortem for these patients at that time, but the diagnosis was actually just alleged jellyfish stings. But the problem is that this could be not reliable. So because when I go to the field, I interview the villagers there. So they say that there is a lot of cases where the boy swimming in the sea and subsequently died as soon as they came out from the water. But because they never bring to the hospital, so the burden of the disease are not known. And furthermore, the jellyfish stings is not a mandatory disease to be notified. So probably this could be more than that. But what we can gather is that from 2006 to 2022 in Sabah alone, there are 6 reported deaths following the box jellyfish stings. And even in Semenanjung also recently, I think last year or this year, we also have 1 fatality in Pulau Bangko, which is also from the box jellyfish stings. But when I did a literature review, the earliest documented paper that shows the evidence of box jellyfish availability in the Sabah is from the John Littman paper that is been published in 2011 that shows tourists who are stung by the probably chirodropic type jellyfish in 2009. So meaning that during these times, the box jellyfish has been wandered in Sabah for quite some time. But until I start working everything, there is not much awareness about these problems. Then we started to have interest on box jellyfish stings after I joined the AMSAM and also the SAM conducted by the REX. So we have this initial case of 7-year-old male who was stung at Kunak in 2015. So if you look at pictures, anybody can have a guess how you describe the skin pattern for this one. And can you guess whether is it a true jellyfish or other things? Anybody would like to take a guess? Semalam kita ada belajar dengan Dr. Aida kan, macam mana nak describe skeleton kan. So what can you see from these pictures? So obviously it's only single leg, but it nampak macam swollen kan, right? And there's a lot of redness around this place, right? And you notice that there's something look like a lash, right or not? So this could be, but the lashes, there's a one or multiple lashes. So it look like a lot of lashes, and it look like macam surrounding berbelikkan dia punya kaki, right? So meaning that must be something quite big that causing this injury, right? So when if this patient come to you saying that he was stung by something in the water, so what are the further history or examination that you want to take? Anybody would like to take a guess? Activity during activity, yes, it may help because sometimes different jellyfish they stay at a different water level and affect the things. But for Chironex Yamaguchi, based on our cases, most of the stings occur very near to the shore. And for other type like jellyfish, like the one that we have the Mobaka before, the patient was swimming more on the more deeper water level, and hence it can affect which area that patient involved. So for example, like the total body in the water, so you can have all the injuries around your body. So meaning that the more bigger the total surface of body area being stung by the jellyfish, the higher the venom load can get to your body, right? So that's a very valid question. Other questions? First aid done, correct. So in Sabah, they have a very weird first aid done. And the weirdest that I have encountered is that they will just find a lady with a very long hair. So they will put the hair inside the mouth. That's the weirdest lah. Apart from that, it's petrol, everything. Right. So first aid and abu, ashes, right, and the vinegars. So we are advocating our publics to use the vinegars. Right. Any other questions? Whether the patient has drawn or not, crack or not in the water, sometimes drawn. Any other comorbidities? Of course, we want to know that what are the times, the exact locations, because you need to know what are the jellyfish there. Sometimes the geographical areas, and of course, whether patient have developed cardiac arrest or not, whether there is any CPR being done in the pre-hospital or not. So there are a lot of questions. The history that you need to take is almost similar to what we learned in the snakes yesterday. Right, so just to share you some of the examples. Right, so the first picture is that this patient was actually swimming in front of the his house, and the injuries are more on the body. So this kind of injuries, the lashes pattern mark for the box jellyfish, especially the Chironex species, is kind of like what we call as a pattern mnemonic. We call it as it's a shoelace appearance. So when you look at the rashes, it looks like your shoelace. So when you see this kind of lesions, almost like it is because of the Chironex. But bear in mind that not all the time patients who were stung by the Chironex will present with this kind of lashes. During our recent encounter, patient came with the allergic-like reactions. So when we look at the hand, it's all just there's some urticaria and also the erythema. So initially we thought that it is impossible caused by the Chironex because it don't have this kind of pattern. But after we treat the patients by giving the hydrochloric printouts, everything, and we examine the patient very carefully, you can't see in the picture because too far, but there's a very small area of lashes mark. So meaning that sometimes that you need to evaluate your patient few times. And these skin lesions, sometimes the skin lesion caused by the jellyfish is progressed as the time progresses, no? So as the inflammation, as your swelling subsides, you can see that the pattern of the tentacle lashes more prominent, right? And sometimes patients in our setting, they come late, sometimes after like 3 days, having sign of infections. So you can see that there's a lot of bullae and there's a swollen and everything. And sometimes patients also apply things like, for example, like the ashes as a first aid treatments. And this one, recent cases that we get in which this patient was being stung by jellyfish for 1 day and have one episode of unconsciousness because of the severe pain, but because they are staying so far in the island, so they only come to the emergency department next day. But luckily for this patient, the airway, everything is very patterned. So we admitted and treated for secondary infections, and patients are actually being discharged after a few days. Right, so this is just to share. But back to our patients. So this patient, they been stung by the jellyfish. The water depth at the time was only half of the meters and very near to the beach. So at the time it was some month of the November. Why we need to know the month, the season, because sometimes the jellyfish distribution, it is affected by their food sources, everything. Sometimes they have the periods of blooming seasons, which is differs from time to time. And was brought to the emergency department 17 minutes post-stung. So when patient arrives, patient is conscious, pain score is about 6 bit, and the only thing that a big difference here is heart rate is a little bit tachycardic during these times. So the first ECG showed sinus tachy with some PAC, but about 1 hour after the stung, patient developed worsening of shortness of breath. So then the staff from the district hospital, they took the chest X-ray at the time about 1.5 hours of stunts. You can see that the patient already developed a non-cardiogenic pulmonary edema, and subsequently patient was intubated and about 12 hours of time, patient actually developed hypertension. If you look at the blood investigation, nothing much can be seen except that initially, most of the time, the total white will be elevated because of your reactive. And the blood test at the time is still would say that quite okay at the time. And patient was transferred to tertiary hospital. So during this time, the antivenom was not available. So patient was actually intubated for 2 days and able to be discharged after 5 days. Right. Okay, so I'll go to the second case. So this is 6 years old female girl. She's a Lau is sea gypsies. So there's a tribe of stateless people in Sabah who are staying on the boats. So they are unregistered people. So she was found at the time. So they stay either in the boat or they build a water house, which is their house is on the water. So when she actually get out from the house and get into the water, it's also about 0.5 meter depth, and she was actually stung by the jellyfish. But initially they put the vinegar. Patient initially looks okay, so that's why the parents did not bring to the hospital early. And only after 4 hours of presentation, they brought the patient to the ETD. So that a lesson that I want to highlight here is that you need to understand that vinegar is not the definitive treatment for jellyfish stings, but it is only a first aid. The purpose of the vinegar is only to deactivate the nematocyst. But whatever venom that already entered the body, it will do its job. So that is very important for you to advocate the public that you need to do the first aid, put the vinegars and bring to the hospital for evaluation. So when the patient arrives to our emergency department, GCS is at the time is a bit low because patient is restless at the time. Blood pressure is normal, but it's very tachycardic at the time. The heart rate was 181, and respiratory is still 26. So judging on the patient condition, definitely the pain score is 10/10. So initially I have the video, but unfortunately my SSD card corrupted, so I only have these pictures. So again, the skin lashes mark shows a typical presentation of the box jellyfish. So during the assessment, patient was very irritable, restless, in severe pain, and also become very tachycardic. And we noted that about 2 hours of ED arrival, which is 6 hours of postings, patient become more in distress. So the X-ray shows taken at that time shows a very bad non-cardiogenic pulmonary edema. So again, the total white was 37 at that time. The CK was 1000. So VBG shows just a bit of going towards metabolic acidosis. COX is normal. So in view of that condition, we administer 1 vial of box jellyfish antivenom, but the condition worsened. Therefore, she was intubated, sedated, and ventilated. And in view of the patient condition become more worsened, which is become more tachycardia and also hypertension, therefore we give another 1 box jellyfish antivenom. But by right, this patient require at least 3, 4 to 6. But during this time, we only have 3 vials of box jellyfish antivenom. I think it's quite controversial at that time because we only have another 1 left at that time, and patients at that time is also non-local, non-citizenship, and because patients are already intubated and ventilated, and at that time there's also some controversy about whether the dose of antivenoms are very this or not. But to cut things short, at the end of the day, we only give 2 vials for this patient. So the patient was admitted and required high ventilator setting. So if you can see that initially the condition actually worsened immediately after the intubations and during the wards. But within 2 days, actually the condition is improving. So based on the investigation, we can see that CK was initially becoming more worsened because of the rhabdomyolysis, but subsequently came down. And then the black gases shows that more CO2 retention. As you can judge from the X-rays, it is very expected. But this patient, she was intubated for, intubated for six days. But we are able to discharge this patient after 9 days. So there are a few more cases of the box jellyfish stings after this event, but we realized that the problem in Sabah is quite difficult because these are some of the challenges that we face. The first thing is actually the exact jellyfish ID and also early diagnosis. So if you realize that in 2006 there is a journal being published about the box jellyfish, but in 2016 we still do not know exactly what are the species of the jellyfish in Sabah at that time. So plus with the other issues, the socio-demographic, geography, and at that time I think we together with the REGS MST we think that we need to try to do something about these things. So we start this thing, we try to search what are the exact species responsible for these things. So I think somewhere this one is 2018. So there's some collaborative effort between the Hospital Lahadatu, REGS, MST, CMAX, Westpac, and also UMS. So we conduct some sampling at area of Sabah, and we also try to analyze the species. So some of you are asking whether is it safe to hold the box jellyfish or not. So different jellyfish species, they have different distribution of the nematocysts. But most of the times, the nematocysts are concentrated at the tentacles. So in fact, in Sabah, this part of the body is a very delicious food. So you can actually just take this, slice it, put some limes and also some salt, and can eat it as a jelly. so since that we finally able during the expedition, we finally able to catch the bug responsible for these things and send for the ID, which is finally in 2018 our colleague from 2019 our colleague from UMS finally be able to identify this species as a Chironex yamaguchi. So which is initially we thought that it is Chironex flickeri at that time, because flickeri is the species coming from the Australia. But the Yamaguchi is from the Japan, and also same with the species in Philippines. So, but for the Semenanjung, so far we still do not able to identify the exact species. But we think that it's still possible this Yamaguchi, and also possible Flickeri also.
I think there's one species from south of Thailand.
Yeah,
from
Indra Sakinje.
Yeah, probably.
Yeah. So far, by 2021, we have about 17 harmful jellyfish species recorded in Sabah has been published by our biologist colleague. But then, coming to case 3, we have this case about, I think 2 years back. We have cases happened actually in Tawau at the time, in which the 46-year-old gentleman with no medical illness was stung by jellyfish while swimming at the depth of 2 meters. So he presented with a delayed onset severe generalized muscle pain, especially at the back, bilateral thigh, and calf. So if you look at this picture, do you able to see any tentacle that I showed before? Can you identify the tentacle? This one, right? But is it similar to the previous cases? Not the same. So do you think that it is the same species? Not sure, right? So this is thing that we are still arguing at that time, because at that time patient was swimming around at the evening. So initially patient felt the pain from the stung. So as usual, when you felt the pain, you get out of the water. So as usual, this patient initially went to the bomo first and giving some air ubat. But then when I asked back, he said that there is just some bacaan recitation of prayers. But about 8 hours after the things, then he visited to emergency department at the time because of the severe delay back pain. And at that time, CK is slightly high, but other blood investigation is normal. So if you are the one managing this patient, what would be possible diagnosis? Anaphylaxis? Others? Irukandji syndrome? Lagi? Okay. So to cut things short, so the patient was treated as Irukandji-like syndrome. So because initially the Irukandji syndrome is a very specific syndrome described after the stung by the Carukia side at the time. But as the time progressed, currently they list about more than about 22 species to be included that can cause the Irukandji syndromes. And some of the species are also available in Malaysia, which is the Mobaka species. But this case actually kind of like a little bit puzzling to us because the Carabdite box jellyfish species that can cause Irukandji is not been seen in Sabah water area at that time. But anyhow, they did some nematocysts. Initially they read the nematocysts but cannot find any nematocysts. So they sent to us to evaluate back the nematocysts. So when we look at examine these things, so there's a very minimal from I think 8 samples that they give. So we only managed to see these few fella. So when we analyze it into 40s, so you can see that this one is actually a nematocyst with the harpoons. So we consulted our colleagues from Australia, and then based on the skin lesion and presentation, that he think that this is caused by the Irukandji group species, possible Mobaka. So therefore we did a trip to find whether is it true that the Mobaka species live in the Sabah water area at the time. So based on our trip, so we found 2 species of Carabdite box jellyfish, or the single tentacle jellyfish, and we did the nematocyst sampling analysis. So, and based on this case, we proved that actually this species also available in Sabah. So the thing that I want to highlight in you is that whenever you get a patient, sometimes that you get the patient come with a specific syndrome or presentation, so you need to think harder. So maybe there are things that caused by new things that have not been described before. So therefore, we finally be able to catch this thing. We think that it is a Mobaka, but unfortunately, we have problems at the time with our reagent in the UMS. Therefore, we are not able to do the DNA analysis for this species. Right. So I think, is it the time? Okay. Okay, there are few methods on how to do samples. Right, most of the time, if you are doing into the more in the area that's more depth,